Hi, welcome to our presentation on chlamydia by nursing students Catherine Dale La Vega, Cynthia Bernardo Reyes, Gabrielle Gayton, Julieta Romero, Nishal Lal, and Sophia Perez. In this slide, we have the content that will be covered in our PowerPoint presentation. So what is chlamydia? Chlamydia is a common sexually transmitted infection that's caused by the bacteria Chlamydia trachomatis. It can affect all people, but especially for a woman, it can cause a lot of damage to her reproductive system. So over to the right, we have a picture of a woman's reproductive system, so the ovaries, and then we have the uterus, cervix, vagina, and fallopian tubes. Below that, we actually have a microscopic stain of the chlamydia cells themselves. Signs and symptoms of chlamydia include painful urination, so individuals may have difficulty in voiding. In women, it's common for them to have any discharge, so not the regular discharge that women have, but it's going to be abnormal. It could have odors, it could have discoloration, and men, the same thing. They will also have penile discharge, as well as sometimes they can have blood in their discharge as well. So individuals also may express pain while having intercourse, and women can also bleed between periods and after sex. Testicular pain in men, burning and itching near the opening of the male penis, and both men and women can get eye infections, which are also called conjunctivitis. So what are the causes of chlamydia? Chlamydia is caused by the bacteria Trachomatis and is spread through oral, anal, and vaginal sex. So semen does not have to be present to get or spread the infection. Pregnant women can give chlamydia to their baby during childbirth. So this is an interesting fact. They actually highly recommend that if a woman does have chlamydia or any type of sexual disease, that the women have a C-section instead of a live birth, because they can spread that to their baby during a vaginal delivery. If the woman does decline, they will just have to go through the protocol and take their precautions while doing a live birth. And lastly, people treated with chlamydia can get the infection again if they have unprotected sex with a person who was already infected with chlamydia. So how is it diagnosed? So screening and diagnosis of chlamydia is relatively simple. There are a few different tests that look for the presence of Chlamydia trachomatis. These tests can be performed if you have symptoms and you're sexually active. So some of the tests include a urine sample, also known as a urinalysis. So that is a sample of your urine that's analyzed in the laboratory for the presence of the chlamydia infection. Another thing is a swab. So for women, your doctor takes a swab of the discharge from your cervix for culture or antigen testing for chlamydia. And this also can be done during a pap smear. So that's why it's really important for us women to get a pap smear done when you're due for it, because that also checks for cervical cancer, but also just staying up to date if you're sexually active to make sure that your body is healthy. So for men, the doctor would insert a slim swab into the end of the penis to get a sample from the urethra. And in some cases, the doctor actually will swab the anus. So if you've been treated for an initial chlamydia infection, you should be retested in about 3 months. This will determine if the infection has been treated or if the doctor needs to evaluate a little bit more and see what's going on. So some of the risk factors of chlamydia are it's twice more common in women than it is men. So, with higher prevalence in women between the ages of 15 to 24 years, and a higher incidence in men between 20 and 24 years of age. So, some other risk factors are having multiple or frequent changes in sex partners, any inconsistency or incorrect condom use, if a person has a history of chlamydia or other STIs, any excessive alcohol or drug use, and any asymptomatic partner or self. So, asymptomatic means without any symptoms. So, your partner could have no symptoms but have chlamydia, and that's how it can get spread, or even you yourself can do that as well. So, that's why it's really important to keep up on those health checks. So, some treatments and medications of chlamydia. So, the treatment depends on your age, health, and symptoms. But first, you should see your primary care provider who will assess the symptoms, then order diagnostic tests, which include a urine test or a swab of the discharge, depending on what they feel is more relevant. In most cases, they will do a urine test and do a culture swab and send those both off to the lab. And then for the antibiotic that's used, it's usually azithromycin is really common. Some nursing management. Definitely, we want to ensure that our patients are being educated. So we want to educate our patients about chlamydia infection. So what is it? Some patients, this is their first time hearing this news. So we definitely want to bring ourselves down to their level of education. If they've never heard of it, then we want to start all the way from the beginning and answer any questions that they may have. We want to encourage our patients to practice safe sex. So that is encouraging the use of condoms, but also letting our patients know that condoms do not always protect from sexual disease as well. So we also want to encourage our patients to remain compliant with their medications and complete the course of antibiotics. This is really, really important for us to let our patients know. A lot of the times people will start feeling better with antibiotics and then completely stop them, which then can put them back to square one, to the beginning where the infection reoccurs. So we definitely want to make sure that they know to take that until all of the medication is gone. So we also want to encourage our patient to notify the partner to come in for a screening test as well. So it could be one partner, it could be multiple partners, but we also want to make sure that that other patient is being taken care of as well. So we also want to encourage the patient to follow up in case of no improvement or any complications that have occurred. Some additional nursing tasks are checking labs for culture results, so being sure that we're being efficient in our care. So if a patient does test positive for chlamydia, then we definitely want to get them started on that antibiotic and start that plan of care as soon as possible. We want to administer any antibiotics that are ordered, and we want to check labs to ensure that the female is not pregnant, as the medication doxycycline cannot be given during pregnancy. Some community resources that are local to the Stockton area are the Planned Parenthood North Stockton Health Center. So they offer any type of free testing, sexual testing. They offer medications, but that definitely depends on the person's health insurance, free condoms, and offer overall support of the patient. Another great resource is community medical centers in East Stockton, which there are multiple in this area, and they offer the exact same thing as Planned Parenthood. So just making sure that our patient knows that there are resources around them, that they have help in this, and that they're not alone. So some online resources for them are STD facts on chlamydia, prevention of chlamydia, free STI testing kits, and then also identifying sex trafficking. because that is something that we do see commonly in our local area. So we just want to be mindful of where our patients are coming from and their stories behind them as well. And in that case, we do want to set that aside and not let that determine our care of the patient. And lastly, we have our reference page as to where we got our information. We thank you so much for watching our video, and we hope that you feel a little more educated on chlamydia. Have a great day.